My theories on why some people react to COVID differently than others. Stay tuned to find out. What's up guys, and welcome back to the channel. For those of you who don't know, my name is Edgman and I'm a pharmacist, and I enjoy making these videos about common questions patients have about medications or any healthcare related topic. So make sure to subscribe for more content. Now to the rest of the video. And also, for those of you who are wondering, I did make a full recovery from COVID, so I have no more fever, no more cough, no more body aches, so I'm good to go, better than ever, and looking forward to making new videos. It's been about over a year since COVID-19 has been mainstream here in the United States, and I want to talk about why some patients have different reactions to COVID or different symptoms compared to other patients. Now, we do know that if you do have underlying health conditions such as COPD, asthma, diabetes, or any immunodeficient or any comorbidity that affects your immune system, your response is obviously much greater, or you have a higher risk when you have COVID-19 than if you didn't. But in this video, I want to talk about why some patients who generally have no underlying conditions react much better than to other patients who also have no underlying conditions. How come they react much worse or have more severe symptoms? And I want to have my thoughts and my theories on this, and I want to say this right now, and I'll say it a bunch of times throughout the video. These are just my theories and my thoughts. This is not backed by any evidence that I know or I personally read. It might have, I'm not sure. I'm just talking about my overall theories and thoughts about it, so take what I say with a very light grain of salt. So excluding patients who have underlying health conditions, how come some patients that I've personally seen, whether it's friends or family or any people I've heard of, where when they have COVID with no underlying conditions, they're fine. They have a light fever, maybe they have a headache, body aches, similar to kind of what I had personally. But I've heard of like patients who also have no underlying health conditions who get COVID, and then they have to go to the hospital. Some of them might even have to get a ventilator. So why is there such a discrepancy between these two patient demographics of how they react to COVID? Now, I don't know, I didn't do any specific research on any studies they've done. I don't think there are much studies because this is more of like something we'll look back on and understand better in hindsight. But right now, my theories are two different theories. My first theory is that there's different strains of COVID-19. Now, I know it's SARS-CoV-2, it's the viral strain of it, which they look for in the test, specifically in a PCR test. Now, when they identify that, I wonder if there's different strains of COVID-19 that patients react differently. So let's say there's a lighter strain. For example, like I got the lighter strain of COVID, that's why my symptoms weren't as severe. And patients who also have no underlying condition, they might get the more stronger, the more severe strain of COVID-19. And that's why they have symptoms such as difficulty breathing or low pulse oxygenation. And so that's one of my first theories, is there might be different strains that they haven't identified yet. I know there's recently talks about different strains coming from the UK or somewhere else, but I'm talking about in the United States, there might be different strains of COVID-19 which creates different outcomes for patients, and that may have not been identified yet, or may not be true, I'm not sure. But that's just one theory I had of why some patients with no underlying conditions react differently compared to others. My second theory has to do with genetics. And I know genetics is a very vague term to throw out there. Like, yeah, it's because of genetics that some patients react more severely with COVID than others. But going a little bit deeper than that, I think it's the genetics of your expression of your ACE receptors in your body. Now, ACE receptors are located throughout your body, specifically in your vasculature and also in your lungs. Now, ACE receptors are a common target for blood pressure lowering medication. So ACE inhibitors and ARBs are common medications such as lisinopril or losartan that are used to lower your blood pressure or keep your blood pressure at bay. Now, why are we talking about blood pressure medications when I'm talking about COVID reactions to COVID symptoms? So apparently COVID, the virus uses the ACE receptor to get inside your cell. And typically, say if you're genetically predisposed to have more ACE receptors, then you have more of the COVID-19 virus getting into your cells and may causing more of a symptomatic response. And there's also ACE receptors in your lungs. So if you have a COVID virus and it uses the ACE receptor to get into your lungs, and if you have a lot of those ACE receptors, then you might have more of a symptomatic response where you have trouble breathing, maybe a lowered blood ox level. So those are patients who are more symptomatic than, for example, other patients, specifically like me. Like when I was, for my case study, like I was not as symptomatic. My blood ox levels was always above 97%, and I recovered relatively fast. Now, I think it's because of those ACE receptors that if you're predisposed to having more ACE receptors, that increases your likelihood of being more symptomatic. Now, to also talk about patients who also are on these blood pressure lowering medications that target these ACE receptors. Now, it could be that if you're on these ACE inhibitors or blood pressure lowering medications, it might cause an increased expression of your ACE receptors. So your body might make more of these ACE receptors, which in turn might makes you more vulnerable to having more of a severe response to COVID. And so there's been talk about patients like not taking blood pressure medications in order to lower their ACE receptor expression, which that has no real medical backing. So I wouldn't recommend that personally for me or professionally for me to anyone watching. However, that's just one theory I had, where if the COVID-19 virus uses the ACE receptors to get into your body, if you have more ACE receptors, which could be due to genetics, it could be due to the fact that you're on blood pressure lowering medications, that might have some impact on why you have reacted differently to COVID-19 than if you there's someone who also didn't have any underlying condition. So remember, this is talking about the sphere of patients with no real risk factors or underlying conditions towards COVID-19. So like I said in the beginning of my video, this is just my theory, this is just my thoughts. I've been brainstorming about this, and I wouldn't take this as professional advice. It's just theory, just something to look into. But I would like to know your guys' thoughts. Like, what are your guys' thoughts on this? Do you guys have any research to back up what I'm saying, or any research to back up that what I'm saying isn't true? You know, I'm always happy to learn, even if I'm wrong. So this is just something I want to bring up as like an open forum to discuss. If you guys have thoughts or ideas or comments about this, like, please make sure to comment in the comment section below. And thanks for watching. Until then, I'll see you guys next time.